Hey guys, Dr. Sean, Gallagher Performance, today talking about back pain, and a common reason why we develop back pain may not necessarily be anything specific to the low back region, maybe more so the pelvis. And oftentimes what's going on in the pelvis from a joint perspective is we might see a counter rotation or an obliquity in the pelvis that can be responsible for mechanical sensitivities as well as creating pain not only within the glutes and the hips but also up into the low back. So here I'm going to show you a quick self-check, or you can have someone help you with this check as well. Again, depending on the nature of your pain and how long it's going on, I always advocate to see a healthcare provider, specifically physical therapist or chiropractor who has training in identifying joint dysfunction and disturbances. But hey, let's get right to it. So what we're going to look at here to begin with is how level the pelvis is. And two landmarks we're going to use, these bony landmarks here on the front of the hip, and then there's two on the back. But to begin with, on the front of the hip, we have what's known as your ASIS. These bony landmarks are usually around the belt line, and you're going to find them bilaterally on each side. And then if you flip around to the back, we have what's known as the PSIS. And those bony landmarks are typically just about an inch or two off of the base of the spine, right off bilaterally, right and left side as well. All right, so these bony landmarks can give us a quick glimpse into what's going on at the pelvis. Ideally, they should be level. If they're not level, and if you're seeing yourself or if someone's helping you with this and one's higher or lower than the other, then we might have an obliqueness to the pelvis, a little bit of a rotational component that could be creating some mechanical sensitivity or pain. As well, on the back side here, we can do that same check, but we can also incorporate some movement to see what type of motion's happening within the pelvis and the SI joints. And to do that, again, we'll keep our thumbs right on the PSIS, but we're going to lift one leg at a time. So in this case, I'll stand on my left leg, lift my right, bring it down, and then I'll stand on my right leg and bring my left leg up and bring it down. And what I want to feel there is I want to see if that PSIS is actually moving. It should, as my leg lifts up, it should drop down and then come back up as the leg comes to the floor. There should be some movement happening there. If there is some dysfunction within the joint, that PSIS is not going to move. It's going to remain stationary as the leg is moving. So again, another indicator that what we're going to do next here from a corrective standpoint can be very beneficial. What we're going to show, it kind of comes out of the physical therapy world. And it's a simple technique to utilize the muscular system and some resistance to help the pelvic bones and the structure basically take that rotation out and find a new normal. Okay, back to position. So we're going to the floor, and if you set a pillow under your head, legs are going to come up in the air. What we're doing here is we're going to take both hands and put them on the knees. One we're going to place below the knee, one we're going to place on top. So if you can see here, my left leg, I'm holding right below my knee, and then my right leg I'm got right on top. And so what I'm going to do here is a counter movement where on one leg I'm trying to pull away, and on the opposite I'm trying to push. So I'm trying to pull and push, and my hands are creating the resistance, so there's no movement. We're creating an isometric, and that's going to be a 5-second hold. Prior to that, we're going to be taking a breath in. So we'll breathe in. As that breath comes in, we're going to initiate that 5-second hold, and it's not going to be a big contraction, maybe 30-40% effort, and it's going to be real gentle. And then we're going to relax. We're going to switch hands, and then we're going to go 5 seconds the other way. Again, pushing, pulling, but there's no movement. Very gentle, 5 second, switch, 4, 5, and switch. So what we'll do here is 3, 4, 5 rounds where you're switching back and forth. After that, we're going to utilize a block. In this video, you can take a towel, pillow, whatever you have available to you to place between the knees. Now, feet are going down on the table here. Blocks going between my knees. Again, you want to use something at home that's got some density that you can push in. So here, now as I breathe in, I'm going to push my knees together, pushing them into the block for a 5-second hold. And then relax. And then push in again. Now, it's not uncommon here during the course of this movement or activity that you might have a audible a shift, a click, a pop within the pelvis, and that's typically the pubic symphysis. The innominates are essentially kind of shifting right back where they should be. So that is a normal indicator, and it should be painless. And again, you repeat that 3, 4, 5 times. So, regardless of what you see during your self-check, or if you had someone screen you, and if, you know, right side's high or left side's high or one side's not moving as well as the other, doesn't matter. We're going to do both sides equally here. Again, we're utilizing the muscular system to help resituate pelvic structure, and from that standpoint, it becomes very gentle, easy way to help restore normal mechanics at the pelvis, get some balance there, help get you out of pain, and reducing discomfort.